Hello, my name is Hillary Bell, and I'm the MLT, or the Medical Laboratory Technician Program Coordinator at WKCTC. I want to introduce you to what an MLT does and kind of go over our stats and then our program outline. So here at WKCTC, the MLT program, we learn about laboratory science. And so what does that mean? That can mean working in a hospital lab. That can mean working and doing like well water testing. There's so much that we could do in this field, but primarily we are instructing you and teaching you to work in a hospital laboratory. Once you're into a hospital laboratory or into our program, you're going to be doing things like typing individuals' blood. You're going to basically start to learn how and diagnose things like cancer or infections, or the list goes on and on. So when you think of a hospital, the diagnosing individual in a laboratory is what is mostly diagnosing and determining your outlook for the future and your future care. What I mean by that is that about 80% of a doctor's decisions or treatment plans are based off of laboratory results. So we determine your hemoglobin. Do you need a blood transfusion based off of that result? Or do you have low blood glucose? And we determine that and let the doctors know. That sounds really scary and exciting, and it's very interesting. I spend lots of time when I was in a clinical setting working with a microscope, working with physicians and nursing staff, and just being a very vital part of the diagnosis and treatment process of a patient in a hospital, all while never having to have direct contact with a patient. So if you're like me, slightly introverted, kind of not wanting to deal with the public every day or a patient every day, or having to deal with what comes with a patient laying in a hospital bed, this is the perfect field for you. So salary starts in the state of Kentucky somewhere around $25 to $30 an hour, and then that goes up depending on the shift you work, the days you work, if you work overtime or things like that. So the current job demand for laboratory technologists is very high. I always tell everybody that the median age for a lab tech in the country, or especially here in our region in Western Kentucky, is somewhere around 55 to 70. And so what does that mean? Think about retirement age. The retirement age is somewhere between 65 and 70. So people are retiring, actively retiring, or they're waiting for somebody to come get their job so that they can retire. So the demand is high. And when there is a high demand, do you know what that means for hospitals and local areas like that? When there's a high demand, there's going to be sign-on bonuses and an increase in pay. So right now, at this given time, I know of several large sign-on bonuses like $20,000 to $30,000 for a year-long contract. So all of the financial aspect, that's very enticing. And what we do is very laboratory scientist, and I get my crazy goggles and I work with microscopes in my white lab coat. But let me tell you how you get there. So our program admissions are pretty simple. So we require that you take anatomy and physiology. Bio 137, Bio 139 here at WKCTC would fill that. We require a general chemistry course like Chem 130, Chem 140. You have to take Math 150 or higher, as well as English 101. Then once you do these prereqs, you can attend pre-admission conferences. Those are held in person on set dates, about 3 a semester in the spring and then again in the fall. We admit students every fall to our program, and we require that you attend one of those pre-admission conferences before we go through the admittance cycle. So when do we admit students? I said every fall. We do a cohort every fall, and it takes you 3 semesters to graduate. So your prerequisites I don't include in that graduation time frame. So prerequisites take anywhere from spring, summer semester, or something like fall, spring, summer. Then you apply to the program while you're doing your prerequisites. You attend one of those mentioned pre-admission conferences. We go through a selective admission process where we look at like your GPA, if you have all your prerequisites done. We admit you to the program and you start the fall semester following applying to the program. Once you're in, you have a semester of just classwork, and then we do classes, lectures, and labs, and we do it in a hybrid format. So that way, if you're looking for something that you can still work and go to school at the same time, there's an option to attend some lectures virtually, and there's very little demand to be on campus except for maybe 3 weeks out of that 16-week semester, that first semester. Once you roll into the second semester of the program, we start your clinical rotations. So what that means is that you're in the classroom for lectures about 2 days a week, and that'll be 8 to 10-hour days. So those are very long, demanding days in a classroom setting. And then those other 3 days of the business week, that Monday through Friday, you're out doing clinicals for probably 2 of those 3 days where you're going to be in a hospital and get to actually work and do patient testing and get to learn more from a clinical preceptor on what goes into a hospital laboratory. So if you didn't know this, West Kentucky is a college. We're not a hospital, right? So I'm never going to have the resources and the availability to mimic a perfect hospital lab. So the purpose and reasoning behind those clinical rotations or those practicum settings is so that you can go get real life experience, get to actually get firsthand experience in different hospitals. I always tell my students this is a great way for you to say, oh, this hospital is exactly what I want to make my career path. Maybe I don't want to be in a hospital and I want to explore something outside of that medical lab portion and just be a laboratory technician. And with that, there's so many options. So the final semester of the MLT program is very similar to the second semester. There's more classroom time and you're going to spend time at those practical sites. Those practical sites like hospitals and so on and so forth, they allow you to just again determine if a hospital setting is good for you or maybe if you found the hospital that's perfect for you. That practicum time is not only letting you find your footing in a hospital lab, it's also a great time to get your name and face out to those lab directors and lab coworkers. It's a great way to say, I just had an informal interview. So in general, that is the Medical Laboratory Technician program in a nutshell here at WKCTC. Thank you.